Supporting mothers and caregivers during the COVID-19 pandemic is important for keeping children healthy and well-nourished. In this video, you'll learn how to support mothers and caregivers during the COVID-19 pandemic to feed their infant or young child. How to adapt your counseling session during the COVID-19 pandemic. How to counsel a mother or caregiver on feeding their young child using the 3 A's counseling process. Assess, analyze, and act. How to build the confidence of mothers and caregivers. The main recommendations for health workers when supporting mothers and caregivers in person during the COVID-19 pandemic are: wash your hands with soap and water before and after each session, and invite the caregiver to wash their hands too. Wear a mask during each counseling session. Be in a well-ventilated area, such as outdoors or in a room with the window open if possible. During a counseling session, it's important to encourage mothers with a young child to continue breastfeeding if they have COVID-19, as the virus does not pass through breast milk to the baby. In fact, breast milk contains all the essential nutrients to help strengthen the baby's immune system and protect them from many infections. Counseling is not simply giving information or instructions. Counselors need to create a safe environment where mothers and caregivers feel comfortable and supported to openly discuss concerns with you. Remember to greet the mother or caregiver with friendly and welcoming body language and words. COVID-19 protocols may mean that the familiar strategies you use to build rapport have to be adapted. Think about how you would greet and welcome a caregiver differently in the context of COVID-19. If you smile a lot, this will not be visible with your mask. You may want to nod your head and maintain good eye contact instead. Also, if you used to greet with a handshake, this is not possible now, but you can guide the mother to where you will sit and explain that she is welcome here. In a friendly way, tell her you cannot shake hands as you used to because of COVID-19. Despite the measures in place to protect us against COVID-19, we can still create a welcoming and friendly environment. Ensure the caregiver feels comfortable. You will now start to discover the 3 A's counseling process. Assess and understand the feeding practices. Analyze whether there are any feeding challenges. Act to improve feeding practices. Assess the feeding practices and try to understand why the caregiver may be experiencing any challenges. When counseling a mother or caregiver, listen to what they have to say and avoid judging words. Remember to ask the caregiver how feeding their child may have changed because of the COVID-19 pandemic or other reasons. It's important to understand their situation and what may be affecting how they feed their child. Reflect back on what the mother says by rephrasing what she said. It sounds like you're worried about whether you can continue breastfeeding with COVID-19. This lets her know you are listening and hear her concerns. And be sure to praise the mother for any positive feeding practices in order to help build her confidence. Analyze whether there are feeding difficulties and prioritize the most important challenges to address with the mother or caregiver, such as the mother stopped breastfeeding. Now, it's time to act on the feeding challenges you've prioritized. Discuss and agree with the mother or caregiver on what changes they will make and the next steps. Agree on when you will meet again. Provide the mother practical information to help improve her child's feeding practices. At the end of the session, remember to identify whether the mother or caregiver needs additional support services and refer them to mother and father support groups, community outreach, and the nearest health facility as appropriate. In summary, when counseling during the COVID-19 pandemic, remember, wear a mask and wash hands before and after each session. Establish trust and build confidence with a friendly, non-judgmental demeanor and positive reinforcement. Assess the situation by listening actively to the caregiver. Analyze for any feeding challenges and prioritize which to address. Act with the caregiver to agree on next steps and changes in feeding practices they will make. And remember, all this is to support the well-being of children in your community. As a healthcare provider, you play an important role.